Hi, this is Rajah Koppla. I am the Managing Director and Chairman of Avis Hospitals. I hope in these trying times you and your family are healthy, and thanks for imposing your faith in Avis Hospitals for the last 5 years. We are India's leader in vascular surgery and daycare surgery. Far before coronavirus came, we were the leaders in believing the fact that the more a person stays in the hospital, the higher his chances of acquiring infection was. Keeping this in mind, over the last 5 years, we have managed to discharge every patient of ours in less than 12 hours of admission, primarily because of our newer methods of treatment and the more modern technology that we employ, and following the latest guidelines worldwide about daycare surgery. We've always stayed away from admitting the patient and charging them room rates and so on, primarily because we believe that the patient should be discharged and sent back to his natural environment as soon as possible. The occurrence of COVID has reinforced our view that frequent and continuous congregation of patients without a proper need and necessity does actually make COVID worse. And this fact is reiterated by the fact that now the entire world, most of healthcare is now moving away from long-term admissions and frequent congregations and so on. We are very aware of the fact that we want to keep our employees and our customers very, very safe. In order to achieve that, we first of all started a detailed screening program for all our employees. Every one of our employees is checked every day for influenza-like symptoms or any symptom that is suggestive of COVID, and even if they call in with any symptoms suggestive of COVID, we tell them to report to the nearest COVID checking center, or tell them not to come to work and take a day's rest and then find out where the nearest COVID reporting center is. Apart from this, we were the first ones to provide PPE equipment in Hyderabad for medical employees. Now, what we did was we actually had our PPE equipment engineered to the highest of capability, which is equal to the FDA standards, and all our employees don PPE equipment including masks, gloves, and so on and so forth. The third point we realized is, we always have maintained that our core strength is vascular surgery and foot surgery and leg surgery. Keeping that in mind, over last 3 months, any emergencies that were not related to vascular surgery were not allowed into the hospital. We said, look, it's an emergency, we agree, but this is not our core, and we wanted this hospital to remain safe for our loyal patients who have all the vascular problems, and that's how we try to segregate right from the start. This is not now, but we start this in March. Now, apart from that, every patient is thermally screened. We actually check the temperature when they enter the hospital. We maintain all the precautions that are prescribed by WHO, including distancing, social distancing, our reception counters, cash counters. Everything has been re-engineered so that this distance is maintained and so that the contact is minimized. Like I said, every patient of Avis Hospital goes home in 3 to 5 hours, far less than that many times. And we now don't have any sharing rooms. All rooms are single occupancy so that the separate air handling system for every patient. The same precautions are followed in theatre. All theatre staff follow, wear the PPE equipment and follow all the precautions prescribed by WHO. The point to realize here is, when we go to large multi-specialty hospitals or very large congregations, your chance of getting COVID is incrementally higher and far higher. In places like this, we succeed. Avis succeeds incredibly because we will have a much smaller cohort of patients. We follow every precaution that is possible, and the problem that you have come with will get sorted out instead of having long intermingling times, spending 2-3 hours to get some diagnostic tests done and then spending a day to get some pre-operative investigations done. All the steps are bypassed and done to the best of patients' convenience and abilities. Thank you so much.
Avis Vascular Centre, India's only comprehensive hospital for varicose veins and lymphatic disorders.